Hi, I'm Dr. Kumar T. Vadivel and I am a board-certified periodontist. I want to talk to you today about some things you should know about getting dental implants. The good news is that dental surgery for implants is about 95% successful. A dental implant provides a stable option for your new teeth, with no slipping or sliding as you could have with dentures. They look and act just like your natural teeth. If you get the all-on-4 implant-supported dentures, it can affect the way you speak until you learn to adjust to them. You may also need to learn to adjust to the extra thickness of the bridge, which is added to the height of your gums. It will also be necessary to learn to watch how hard you are biting down on your food. You will not be able to tell as you could before the implants because the sensation will be different. Even though dental implants do not get cavities, it is still just as important to brush your teeth regularly and floss. You still have a danger of periodontal disease, which could result in the loss of your implants. You will also still need to make regular dental visits about twice a year to ensure good oral health.